Hello, Cavaliers. I'm Mrs. Sweetapple, one of your administrators here at WH Croxford. Here is your COVID-19 training as we prepare for the school year. Chief Medical Officer of Health for Alberta, Dr. Hinshaw, has said, "Every Albertan has a role to play in keeping their friends, family, and neighbors safe. Diligently following the health measures in place means you are being considerate and caring, not overcautious or afraid. Let's all see it as our personal responsibility to follow the health measures and keep people safe." COVID-19 is an illness caused by a coronavirus. Human coronaviruses are common and are typically associated with mild illnesses similar to the common cold. Symptoms of COVID-19 include fever, cough, sore throat, runny nose, and shortness of breath. Symptoms may take up to 14 days to appear after exposure to the virus, and the virus is most commonly spread from an infected person through respiratory droplets when you cough or sneeze, close personal contact such as touching or shaking hands, or touching something with the virus on it, and then touching your eyes, nose, or mouth before washing your hands. The symptoms include tiredness. The body feels completely tired without energy. High fever. The body temperature can exceed 37.3 Celsius degrees. Dry cough. Constant coughing without expelling any mucus. Difficulty breathing. Breathing actually feels more difficult. Many people infected with COVID-19 show mild symptoms, especially during the first stages of the disease. Thus, you can still catch the disease from an infected person who only has a mere cough and does not feel ill. These people are asymptomatic. COVID-19 spreads in two ways, through people and surfaces. The disease can spread from person to person through small droplets from the nose or mouth when the infected person coughs or exhales. The disease can also spread when small droplets land on surfaces, which means any person that touches these surfaces and then touches their eyes, nose, or mouth before washing them can become infected. There are 6 main ways to best prevent the spread. 1. Wash your hands often for at least 20 seconds. 2. Practice physical distancing at all times, at least 2 meters. 3. Avoid touching your eyes, nose, or mouth, especially with unwashed hands. 4. Stay home if you are sick. 5. Cough and sneeze into your sleeve and not your hands. 6. Wear a non-medical or face covering to cover the nose and mouth. About 80% of people recover from this disease without needing special treatment. As part of this COVID training, it is important to know your rights and responsibilities. The Alberta Occupational Health and Safety Act has a number of responsibilities that all employees must follow. It is reasonable to expect that students would also follow these guidelines. Stay informed about COVID-19 and any Alberta health updates. Take reasonable care to protect yourself and others. Use safety equipment that has been provided to you. Report any concerns about unsafe or harmful conditions that you see within the school to your teacher or to an administrator. Comply with safety instructions and cooperate with any staff member who is carrying out their duties. In accordance with Alberta Health Services guidelines, every Albertan is legally required to self-isolate under the following conditions. 1. Minimum 10 days from start of symptoms or until symptoms resolve, whichever is longer, if you have a cough, fever, shortness of breath, runny nose or sore throat, and not a related pre-existing condition. If feeling unwell, take the self-assessment questionnaire. Do not come to work if you are sick. Secondly, if you've tested positive for COVID-19, then you must self-isolate for a minimum of 10 days or until symptoms resolve, following recommendations from Alberta Health Services. Lastly, you may have symptoms of COVID-19 but have tested negative for it. In this case, if you have known exposure to COVID-19, then you must isolate for 14 days. If you've no known exposure, then you're not legally required to self-isolate, but you are asked to please stay home until symptoms resolve so as to not infect others. Anyone can be tested for COVID-19 at any time without having symptoms. Having a test that is negative will shorten self-isolation time until symptoms resolve. There are 2 other instances with responsibility to self-isolate. That includes close contacts of confirmed cases and travelers. You are required to isolate for 14 days and monitor symptoms. And if you become sick with symptoms, you must isolate for an additional 10 days. According to the Alberta Health Services guidance document, individuals who have allergies or ongoing health issues must be tested at least once to establish a baseline of pre-existing conditions. If symptoms change, worsen, additional symptoms, or a change in baseline, the individual must stay at home and use the COVID-19 self-assessment tool to determine if testing is required. Students are expected to use the daily screening checklist. But what happens if you begin to feel unwell while you're at school? If a student begins to feel unwell at school, they are required to come to the main office. Teachers may call down to administrators who will come and escort the student down to the office, where they will be placed in one of 3 infirmaries. The student will be required to wear a mask, and parents will be contacted to collect them. Once the student has left, a sign will be posted showing that that infirmary must be thoroughly cleaned and disinfected. In the event of a confirmed case of COVID-19 in our building, there is a process that will be followed, and Rocky View Schools will follow the direction of Alberta Health Services. Alberta Health Services will take the lead on information gathering and communication protocols. Administration is responsible for knowing who is in the building and where they work or learn, and their contact information. Teachers will be methodically taking attendance. If an employee or a student has tested positive, they will need to self-isolate immediately until recovered. If a staff member or student does end up having a confirmed case of COVID-19 and believes the transmission was at our school, a thorough investigation will be conducted. Information will be gathered to determine the timeline for contact tracing. We'll be cleaning and sanitizing all areas where the employee or student were present, and we will identify any of the co-workers or students who may have been in close contact to advise them for symptoms. This is why it's so important that you stay in your assigned seats and that teachers conduct their attendance methodically. At all times, steps will be taken to not disclose the identity of the person who has tested positive. Rocky View Schools has implemented several measures to keep both students and staff safe in our buildings. Please review all related materials on the RVS website and Scenario 1 plan. Enhanced cleaning protocols ensure common areas and frequently touched areas are cleaned more often. Classrooms will be provided with disinfecting wipes and spray bottles for cleaning of shared spaces and shared materials. Staff are encouraged to leave the building by 5 p.m. each evening, so there's enough time for a thorough clean. Cleaning and disinfecting materials are chosen to ensure the safety and health of staff and students. Protective measures for hygiene include hand sanitizer stations throughout the building, as well as instructional posters on how to wash your hands, how to wear a mask, how to use the hand sanitizer, and covering your cough. There will also be more regular washroom cleaning. This year, a number of items of personal protective equipment will be in use. First of all, hand sanitizer is available in classrooms and throughout the school. Students and staff are asked to use this liberally. There will be masks and face shields worn by staff. Sometimes they may even be wearing gloves and gowns. Students, you will be provided with 2 face masks. We ask that you please wash them before wearing them. It's important to wash them in cold water and tumble dry on low, or hang them to dry. Another protective measure is social or physical distancing. Whenever possible, staff and students are asked to remain 2 meters apart from one another. In classroom spaces where this is not possible, students and staff are requested to kindly wear their face masks. Schools and building sites will have put in place various practices for physical distancing, which may include hallway markers to direct traffic, markers for line-up at offices and common areas, marking for parent drop-off and pickup and for the bus line-up, as well as assigned entrances for various classes. A number of other measures have been implemented for your safety. Visitors and guests are not allowed at WHC at this time. As well, there is a principal checklist and school daily practice template that will ensure safety requirements are in place. These resources include the Alberta Health Services COVID-19 Screening Questionnaire. These will be posted throughout the school and are available online and in our WHC All Staff COVID-19 Resources folder. Please remember that hand hygiene is one of the most important things we can do to keep ourselves and others healthy. Please be mindful of how to wear a mask and take care when putting it on or taking it off. When using hand sanitizer, be liberal and thorough in its application and rub your hands together vigorously in the same manner that you would if using soap and water. This concludes your COVID-19 training, students. Please do ask your teachers if you have any questions. Thank you for helping to keep our school community safe. And that's all for this week's edition of Cavaliers Connect. Have a great week, everyone. And remember, get ahead. Get graduated.